I often get questions from patients around sexual activity. Patients will ask, did sexual activity cause my pain? Should I avoid sexual activity because I have pelvic pain? And the answer is sometimes. So sexual activity can mean many different things, include many different behaviors and activities. And bottom line is sexual activity should never be uncomfortable or cause pain. And sexual activity is different for everybody. What's right for one person may not be right for another person. So it's a very personal decision. So when we talk about sexual activity and pelvic pain, there are a few scenarios during which you may want to take some precautions with some particular sexual behaviors. For example, if you're engaging in sexual intercourse and vaginal intercourse causes tearing of the vulvar skin or injury to the vulvar skin, that vulvar skin health needs to be prioritized. That skin health needs to improve before engaging in further vaginal intercourse. Another example is if during sexual activity you experience tremendous fear or anxiety of causing more pain if you engage in sexual behavior. If that's the case, it's probably best to consult with a sex therapist to get guidance on how to proceed and how to engage in sexual activity that doesn't cause severe fear or anxiety. Another issue concerns folks that have pudendal neuralgia. Pudendal neuralgia is when the pudendal nerve, which is the primary nerve of the pelvis, is irritated and results in pelvic pain. Nerves don't like to be stretched too much. So the pudendal nerve travels throughout the pelvis, and one of those branches travels up the penis. And so if a person has pudendal neuralgia and we elongate that nerve during sexual activity, it could further exacerbate the pain. So this can happen with aggressive masturbation of the penis or aggressive manual stimulation of the penis. That would cause an over-elongation of that branch of the pudendal nerve that could further irritate the pudendal neuralgia or further exacerbate pudendal neuralgia. Lastly is concerning orgasm. Normally, when we orgasm, the pelvic floor muscles rapidly contract and relax, and this is a normal function of the pelvic floor. Now, if those muscles are too tight to begin with, as is the case with many people that have pelvic pain, orgasm could be irritating or could exacerbate the pain. So when we engage in sexual activity, if we have pelvic floor muscles that are too tight, we want to be sure to not delay orgasm, otherwise known as edging, as that could over-contract the pelvic floor muscles, making them even tighter and could exacerbate pelvic pain. So even with all of these precautions, it's important to note that irreparable damage is highly unlikely during sexual activity. Even if an injury is incurred during sexual activity, the truth is that that injury, with the right treatment, can be resolved and your pain can go away. This is not irreparable damage. It's also important to note that these modifications that we're discussing around sexual activity are modifications that are temporary. So as you go through treatment for pelvic pain, even though you may have to make temporary modifications to sexual behavior, most likely after treatment has concluded and your pain has decreased, you'll be able to return to whatever sexual behavior that you desire. One thing to note is that after sexual activity, particularly after orgasm, it's just good to practice relaxing your pelvic floor. As I mentioned, orgasm causes a tightening of the pelvic floor naturally, but if those muscles are tight to begin with, after sexual activity and after orgasm, you want to focus on relaxing those muscles to help bring them back to a more restful state. Most likely your physical therapist has given you exercises to help relax your pelvic floor at home, so be sure to do those after sexual activity, particularly after orgasm. So if you feel like you incurred your pelvic pain during sexual activity or that your pain is increased during sexual activity, don't panic. Talk to your physical therapist about specifics for your case and for your particular body on ways that you can still engage in sexual activity safely and to not further exacerbate your pain.